Let's talk about the digital rectal exam, or DRE, for prostate cancer screening. So we call it a digital rectal exam, but it's not digital in the sense of using computers. It's digital in the sense of using your digit or your finger. And the urologist basically places their finger into the rectum of the patient and then is able to feel the backside of the prostate. And when they feel the prostate, they can see if there's any areas that feel hard or concerning for prostate cancer. And for many, many years, this was the backbone of screening for prostate cancer. That if your urologist detected any areas that felt firm or concerning, then you would go forward to get a prostate biopsy. And in many places around the world, this is still the backbone of prostate cancer screening. The question is this test really worthwhile? Now, it's important to understand the other screening tool is the PSA, or prostate specific antigen. This is essentially a blood test that's done to determine the level of prostate activity. It's also not a perfect test. It can be elevated for a number of reasons, and there are some men with prostate cancer who don't have an elevated PSA, but it's still a very good test where the higher the PSA, the more likely there is to be some sort of prostate cancer. So for a long time, people have sort of used both tests. You get your blood test, your PSA, and you get your physical exam, your digital rectal exam with the urologist's finger. And if either of those are abnormal, you proceed to either an MRI or a biopsy or something. But you could imagine that the finger exam, the DRE, is not fun for patients or providers, and two, it is not that sensitive, right? You could easily miss a lesion, or you could feel something that you think is abnormal, but it turns out it's not actually abnormal, and you're really only feeling the back side of the prostate. You're missing the whole front side of the prostate with the finger exam. So people have really called into question if we really should be doing this DRE in the setting of having another prostate screening test, the PSA. So there was a study that was published in European Urology Oncology, which is one of the top journals in urologic oncology, or basically cancer of the urologic system. And it's published in 2024, and it's a multi-institutional study, but based out of Austria. And basically what they did was a meta-analysis where they didn't actually enroll any patients into this study. They basically studied the existing studies. They pulled the literature together to combine the data and do a meta-analysis of all the statistics that exist. So basically, after their thorough review, they found 8 studies that were worth including in the meta-analysis, which included nearly 90,000 men. And all of these studies looked at both the PSA and the DRE, and they essentially determined, is there any benefit to doing a DRE if you're already doing a PSA check? And essentially the answer was no. There was very little to no added benefit to doing a digital rectal exam in terms of prostate cancer detection if you're already doing a PSA test. Now, a lot of older urologists will be very upset to hear about this because they have been doing DREs for many, many years. But I'm very happy to hear about this because my patients hate the digital rectal exam, and it doesn't really add a lot of value. I've suspected that for a long time. So in my practice, unless there's a specific reason why we should need to do a digital rectal exam, we don't routinely do it for prostate cancer screening, and we don't recommend that primary care physicians or anybody else do it as a method of prostate cancer screening because it adds very little value, if any, probably none, and patients hate it, and it adds time to the encounter.